Welcome back to Drug Talk, everybody. In today's video, I want to go over 3 things you should be aware of before using metformin. Number 1, when you start using metformin, you may experience diarrhea. Diarrhea is a fairly common side effect with metformin. In terms of percentages, when using the immediate release formulation of this medication, patients seem to experience this side effect about 53% of the time. Diarrhea happens less often when patients use the extended release formulation, happening about 10 to 13% of the time. This side effect typically resolves after some time of using the medication if it's used continuously. Only a few cases of chronic diarrhea have been reported after months or years of taking metformin. The amount of time it takes for diarrhea associated with metformin to go away is different for everyone. It's important to note that if the diarrhea lasts more than a few weeks, it's a good idea to have a conversation with your prescriber to see the best approach of how to move your treatment forward. Foods that may trigger or increase this side effect are best to be avoided. These would be foods that are high in fat, sugary, or fried foods. These foods often contain trans fats, are served in large portions at restaurants, and contain a lot of sodium. Number 2, when using metformin, you may experience a cobalamin or vitamin B12 deficiency. This side effect occurs less frequently than diarrhea. Roughly 7 to 18% of patients using metformin may experience this deficiency. There are some general physical symptoms of vitamin B12 deficiency. You may feel tired or weak, or experience nausea and vomiting. And like we mentioned before, diarrhea could result as a symptom of the vitamin B12 deficiency. So if you're experiencing these symptoms for a prolonged period of time, getting your vitamin B12 levels checked may be a good idea. The risk is increased if you use a higher dose of metformin or if you're using the medication for a prolonged period of time. The risk is also higher if patients use metformin with other medications known as proton pump inhibitors such as pantoprazole to help with their acid reflux. Aside from the vitamin B12 deficiency, some patients may also experience a deficiency in folic acid. Some resources state that patients using metformin long-term should supplement with vitamin B12 and folic acid, or at least have the levels of these checked frequently. And number 3, one serious side effect of using metformin is lactic acidosis. Lactic acidosis is when the body produces too much lactic acid and can't metabolize it quick enough. This condition can sometimes become a medical emergency. The onset of lactic acidosis could be quick in some patients, taking just minutes or hours, and in some patients it could be more gradual, happening over a period of days. It can present as decreased tissue oxygenation or low oxygen levels in the blood. There are some common symptoms of lactic acidosis. You may experience a fruity smelling breath, fatigue or exhaustion. Some patients may experience nausea or vomiting. Fast, deep breathing is a possibility, as well as muscle cramps, body aches, or abdominal pain. And lastly, some patients may experience confusion. So if you experience these symptoms while using metformin, be sure to see your prescriber right away. And that's all we're going to talk about today with metformin, but before you take off, I wanted to let you know you can pick up a copy of my book, The 5th Episode, Inside the Manic Mind, by clicking on the link in the description of this video. Take care.